What's going on, guys? So check it out. I am recording this tutorial to show you what I do when I'm just like, oh, I need to make a video, but I don't know what to make. So on my screen, I'm running Zoom to record my screen. I'm using a Rode mic, right? That's a USB. And then next to it, I've got this little lapel mic that plugs into a Canon 80D DSLR. I've got my key light right to my left. And you know, one of the things, if you look behind me, see how that's blurred in the background? So I always wondered how YouTubers get this kind of depth of field. So I want to give you the exact specs. Right now, the camera, I can put my hand on the top of my Canon DSLR. So it's exactly an arm's length away. The mic is exactly about 9 inches from my mouth. That wall back there is about 8 feet away from me. And so, and then I've got a window in front of me with my key light right here. So I'm getting plenty of light. Obviously I could have shaved, I could have cleaned up, but sometimes you just got to make it happen, right? So behind me on the screen, you see Google. What I'm going to do is I'm going to record a native video on my Canon DSLR that I'm going to release on my YouTube channel. But behind me, I've got Google set up, and I did a keyword search. How painful is a total knee replacement? That's one of my blog posts. I've already done a video on that. But if you see here, I've got related keywords from Keywords Anywhere. Why is a knee replacement so painful? What not to do after a knee replacement. So when you're looking at that, that is actually coming from down here, searches related to how painful is a total knee replacement. It's exactly the same thing. Why is a knee replacement so painful? What not to do after knee replacement? How long will I need pain medication? So you see the top section of Keywords Anywhere is just the bottom section of your Google search. And then people also search for knee replacement pain at night. You know, you've got, I mean, look at how many content ideas we have here, right? So I think I already did a video on why is a knee replacement so painful, but what about what not to do after a knee replacement? That's going to be a good one. That's what I'm going to record right now while you guys are watching. So let me pull up my video again. And you know what I could even do? That'd be interesting. I'm going to click on that link. I'm going to come in here, exercises to avoid after a knee replacement. That's kind of a shame to see that. What to avoid after knee replacement. Let's go in, and that's the snippet, right? What to avoid after knee replacement. So maybe I want to steal this snippet. Orthobethesda.com, restoring function. This would be something worth chasing. Schedule an appointment, pay online. You know, it's a tiny blog post. I can absolutely outperform that. Taking precautions after a knee replacement. Exercises to avoid after a knee replacement recovery. All right, let's do this. I'm gonna snag this. Let's go back a second. This turned into a full-on tutorial. Sorry, guys. So this says exercises to avoid after knee replacement. Running, jogging, weight training. That's a shame. Let's find out where that is. Exercises, no. What you can do. That's interesting. Exercising benefits your health. Some exercise, however, harm the good. I don't see. Where is that? So let's go find exercise. Oh, there it is. To avoid after knee replacement. So what Google did was it grabbed that, and let's do a little investigating since we're here. So that's an H2 tag, exercises to avoid. And then it started grabbing this stuff right here. It skipped this section in the middle. All right, now I haven't planned this at all. I haven't scripted anything. I haven't done anything. But what to avoid after a knee replacement. Okay, here we go. Let's think about this. Hey guys, Tony Maritato here. Welcome to the Knee Replacement Support Group YouTube channel. In this video, I want to talk about exercises and other activities to avoid after a knee replacement. Now, if you've watched any of my content, you already know I am a licensed physical therapist, and my mission in life is to help you do everything you want to do. I always say you had a knee replacement to live your life to the fullest. You didn't have a knee replacement, so you can avoid activities, right? But I do think there is some benefit to understanding some of the things to avoid, and you know, getting an idea of when you can start to bring these back into your program. Because generally speaking, I'm a believer there is nothing you can't do. You just have to prepare yourself to be able to do it. So initially, let's talk about the first week after surgery. What are some of the things that you should avoid? Well, contrary to popular belief, you should avoid overworking the knee. During the first week, you want to move, you want to get up, you need to get up and move around. If you're drinking enough water, you're going to get out of your seat every 1 or 2 hours to go to the bathroom. That's awesome. That's perfect. That's exactly what we want. What you want to avoid is being in so much pain that you're not moving, being so fearful that something is wrong that you're not moving the knee. And that's usually what I see when somebody isn't moving enough. It's not because they don't want to. It's not because they're lazy. It's because they're afraid. They're afraid that they're going to do something wrong. They're afraid that there's something wrong with the procedure, and they don't have somebody that they can trust, that they can ask the questions and get peace of mind. You know, the surgical team isn't always there. The nursing staff, home health, they're not always available. So one of the things that I do with my practice is we have a phone number. I'll put a link in the description of this video. It is a paid service, but if you want, if you're just like sitting there terrified, you don't know what to do because something just doesn't feel right, but you don't think it's an emergency situation, you can call a therapist to ask some questions and just get some peace of mind. Like, hey, is this normal? Okay, so number one thing not to do after a knee replacement is allow the pain to become so intense that you're afraid to move, and don't move. You need to get up and move around. The pain should be manageable during that first week. Into the second, third, fourth week, right? What not to do. We want you moving. We want you progressing from a cane to a walker to independent ambulation, but we don't want you taking unnecessary risks. We don't want you doing things. So if you feel groggy, if you feel lightheaded, that's not the time to push yourself. That's the time to figure out what's going on. Find a therapist, go to your surgical team, ask them what you can do. I realize not everybody has access to great physical therapy, so you need to find somebody in your corner that you can work with. And we want to make sure that your team is managing your medication appropriately. I know that not every medication works for every individual, so if you feel like you're not getting the pain relief you need, talk to your surgeon, talk to the medical team, see if there's something else that they might want to switch or try that allows you to manage the pain and get you moving again. In terms of exercises, probably the biggest thing, and you've heard me say it if you've seen my other video, don't overdo it, right? Lower to light intensity, frequent episodes of exercise is really the best thing after surgery. A 30, 60, 90-minute workout once every other day is not going to benefit you because it just beats you up and wears you out. Many people during the first 6 weeks after a knee replacement are experiencing, you know, lightheadedness, dizziness, fatigue. You just feel worn out. You walk from the couch to the bathroom and you're like, feel like you ran a marathon. That's normal. You might have a low blood count. You might have a little bit of anemia. You're probably not sleeping real well. The pain is running you down. So these are all common symptoms that people are experiencing with. And it's just important that you keep in mind. Exercise is really designed to further break down the tissue so that your body can repair during rest. If you're not recovering during your rest periods, we need to recalculate the intensity of the exercises that you're doing. So Look at your basic rehab program, whatever you've been prescribed, and then determine what is the appropriate frequency for you. You might need to do less than they told you. You might do more than they told you, but only you know your body and only you know what you can tolerate. Big picture now, moving past 6 weeks, going to 12 weeks, half a year, 12 months. We want to continue to exercise. We want to continue to gain range of motion, movement, reduce swelling. It's certainly not unreasonable that somebody would have swelling going into 12 months after surgery. I see patients that are 12 months post-op and they still have warmth, they still have redness, they still have some sensitivity in the knee. But it's one of those things that we're trying hard to manage while we're gaining strength, range of motion, resilience, endurance, all of that kind of good stuff. So typically, jogging is going to be one of those exercises that is not going to be recommended following a total knee replacement, simply because managing the impact, and we don't want to run the risk of wearing out the prosthesis sooner than it should normally wear out. The other reason that you have to really consider if running, jogging, playing impact sports is something you want to go back to is because we don't know the quality of the bone health. The surgeon was in there. The surgeon knows what everything looks like. I would always, as a therapist, defer to the surgeon to make those determinations, because I don't know what the hip and the ankle bone health is like. I don't know how well the implant is secured in there. And for a therapist, without knowing those things, to simply say, oh yeah, go ahead, if you want to run, I think it's somewhat irresponsible. So the decision should be made across multiple people on your team to decide how important things like running and higher impact sports are. And if the risk of wearing out the prosthesis or causing complications outweighs the benefit, it might be something you decide not to do. Finally, the long-term benefit of connecting with a team that you trust, that you like, that you can connect with. Most patients will have a 12-month follow-up with their surgeon. That's your time to really get in and say, okay, doc, I've done all this stuff. This is where I am. This is where I want to be. What's the next step? You know, because this is your knee. You're going to live with it the rest of your life. And we want to make sure that you're getting the highest possible outcome for the pain and the time and the cost that you invested in having the replacement done in the first place. So guys, like I said, I'm not about telling you what you should and should not do, but there are certainly some things that I think we don't necessarily stress enough. Don't overwork it, but keep it moving, right? Pretty simple advice. Keep it simple, silly. That's generally my formula for most things. As always, thank you so much for watching. I hope this answered some of your questions. If I didn't address one of your questions, or you have a question that's unrelated, do me a favor, post your questions in the comments below the YouTube video, because your questions help me produce better videos. And in the meantime, like the video, subscribe to the channel if you haven't. And as always, I look forward to catching you on the next video. I'll see you then, guys. Okay, so that was, I think it was like a 8-minute video. I just recorded it. You saw it. I recorded it live, one take. What I'll do now is I'll go download the video onto the computer. I'll grab a screenshot that I can put on my thumbnail. I'll title the video exactly what the SEO recommendation was, what to avoid after a knee replacement. And then I'm going to create a blog post, try to steal that snippet, and we'll see how it goes, right? I'll keep you guys in the loop. I hope this video, well, you guys can't see me. I'll keep you guys in the loop. I hope this video was helpful. Just like I said to my knee replacement group, if this content helps you, the best way for you to show your support for me and the content I'm producing is like the video, this video, subscribe to the channel, this channel, and watch these videos from start to finish, because that is what gets the YouTube algorithm going, and that's what helps us share this content. Guys, For you, the clinicians, I'll catch you on the next one.